Good morning, friends. Mike Collins here from Healthway Compounding Pharmacy with one of my favorite guests on our show, Dr. Carrie Topouzian. How you doing today, buddy?
I'm doing good. Hey, wait, is this your show or my show?
This is our show.
Our show. Okay.
Yeah. That's the way we got to make it work. So, get a little plug for both of us in there.
Sure.
Heck,
absolutely.
Yeah. So, hey, what's our topic going to be today?
The topic's going to be cancer screening.
Serious
And
subject.
what's really interesting is one of my nurses, she texted me this morning about a half hour before we were going to do this video. And this is synchronicity, okay? And I'm not talking about the Police album, okay? I'm talking about,
I had that album.
I did too, yeah, it's a good album. She texted me and it said 70% of people who die of a cancer there is no routine screening for. Okay?
So let's talk about some of the routine screenings. What are the screenings that are being done right now?
Mammogram for women, obviously.
Okay.
Pap smear.
Yep.
There's some basic blood work that you can screen for. There's some gene testing, BRCA1 and 2 you can test for. Colonoscopy, obviously.
Sure.
You know, they're looking for precancerous lesions.
Yep.
Or you go to your dermatologist
Yep.
and they're looking for, again, precancerous lesions or
right.
cancer. So those are all, they're like screening tests.
Sure.
But based on this statistic, it's not good enough.
Yeah.
Okay. And it's kind of scary because, so the question is, what do you do? And the fact is there's a lot of other tests out there that you can do for screening for cancer. And that's one of the things we're going to talk about today.
So where would you go to get some of the screening done? And what kind of physician, if we're not going to work with an oncologist, who could work with some of these alternative screening methods?
Well, I'm going to say that usually an oncologist, they're not screening you for cancer. You've already got cancer and you're seeing the oncologist when you have cancer. It's usually going to be your family practitioner that you're seeing. If you're lucky, I shouldn't say it that way, but I'll say it. If you're lucky, you have a functional medicine practitioner who's versed in these kinds of things. If not, you may have to educate your physician or ask them to do these tests that we're going to talk about today.
Sure. So what about some of the other ways that are not so obvious that people maybe don't know about?
Yeah, there's certain testing that you can do. For example, there's a blood test called homocysteine, which is looking for the MTHFR gene mutation. And you probably don't know, but MTHFR gene mutation, sometimes they call it the mother...
Trucker?
No, mother-father gene. Easy to do. It's a blood test that you can get Quest, LabCorp, and other labs. But if it's elevated, it's a risk factor for breast cancer. And then there's also a urine test. It's called a Dutch test, which what it does is it looks at hormone metabolism. So what that's doing is you're looking for women and for men, you're looking for estrogen metabolism. How well are you getting rid of your estrogen? And I say guys too, because guys make estrogen, and you have to get rid of it out of your system. Anything that'll cause breast cancer in women can cause prostate cancer in men because both of those parts of the body come from the same part of the embryo. Hopefully I'm saying that right. So with the Dutch test, it's a urine test that looks at 3 different methods of metabolism for your estrogen. And one of them is it looks for a methylation pathway. And methylation is similar to that MTHFR gene mutation, where you're looking at a carbon hydrogen to the third and seeing if you're getting enough in your system. And what happens is this helps your liver detoxify estrogen. Okay.
Got it. Right.
There's also in this Dutch test, and it's something that your physician, healthcare practitioner can order. You might even be able to get it yourself done. Dutch test has 2 other components. One is it's looking for xenoestrogens, which are environmental estrogens, which can cause DNA damage. And so the treatment for that, if you have that, is you take glutathione, which is a supplement, which you can get at most compounding pharmacies.
Like Healthway.
Like Healthway,
yeah.
or other health food stores. But usually compounding pharmacies have a, what would you say?
More purified form. I guess it's more,
less additives.
Yeah.
Things like that.
Right.
And then the third one is It looks at the types of estrogen that you're metabolizing and if they're stronger than they should be. Like the goal is when you have estrogen in your body, you're supposed to break it down into a weaker estrogen. Some people make it into a stronger estrogen, and there are certain supplements that will help that too. CDG, which is calcium D-glucarate, DIM, I3C, also supplements you can get at compounding pharmacies.
Awesome.
Okay. And then I guess the last thing we'll talk about is there actually is a blood test that you can do. It's a screening test for cancer. There's actually two companies. One's called Gallery, which is located in the United States, and the other one is called RGCC, which is located in Greece. And basically both of these labs, what they do is you send in your blood work and it looks for circulating tumor cells. So it's looking for stem cells that are from some type of very early cancer that you may not know about. Okay?
That's very
so
interesting.
what's the benefits of that? You should be asking me. So what's the benefits of that?
Yeah.
Well, the benefits are that you're catching cancer at a very early stage, earlier than you may with some of these other types of screening methods.
Oh.
Okay. And then, so what do you do? What do you do if you come back with a positive test? Well, believe it or not, the one lab out of Greece, they actually have a treatment. If you come back with circulating tumor cells, they have a treatment called an SOT. And we'll put links in the notes for all this stuff. But basically, in layman's term, what this SOT does is it finds the cancer cells and it attaches to them and it tells the cancer cells, you are not immortal, die.
Mm-hmm.
Then it goes to the next cell and it keeps going, keeps doing that for about 3 or 4 months. Again, we'll put information in so you can read about this.
Yeah, very good. Oh, that's really good stuff.
What else should we talk about?
Well, we want to know how they find the functional medicine physicians and maybe just a little brief information about the difference and what they're training, how they differentiate.
You know, functional medicine is like holistic, integrative medicine. We're trying to find the underlying cause of a problem. We have a lot more tools in our toolbox, if you will. We have a lot more testing available that at least we know about. We're trying to find ways to fix an underlying problem without just putting people on a medication. Now, I'm in Michigan. I have a license in Texas, Colorado, and Michigan. Obviously, if you're in those locations, you could see me if you were interested. But if not, we'll put down in the notes also like some links where you can try to find a functional medicine physician.
Yeah, that's great. And you also can do televisits.
Yes, we can do that too.
Yeah, so you could work in those other states without them getting on a plane and flying here.
Right.
Although we'd like them to fly here.
Oh yeah, sure. Yeah. Why not? And if you're in, if you're in Michigan, Healthway Compounding Pharmacy is in beautiful Saginaw, Michigan.
Yeah, it's a great place to visit.
They will ship anywhere in Michigan.
Yeah.
You ship anywhere
We're licensed, no, because we're only licensed in Michigan, so we have to ship in Michigan.
That's enough.
Yeah,
There's a lot of people here.
A lot of people here, and a lot of sick ones too. But you're trying to fix them one at a time, right?
One at a time.
One at a time.
Yep, that's the only way to do it.
All right.
All right. Well, thanks for watching, and if you haven't already, please subscribe to our channel and take care of yourself.
All right. Bye now.